Hello, my name is Dr. Paul Bacon. I am the Director of Advanced Spine Health and Wellness in Portsmouth, New Hampshire. Recently, I read an article from the Annals of Internal Medicine on a study that they had done on about close to 300 patients over a course of about a 12-month period. And it was for the treatment of nonspecific neck pain. And they were speaking about SMT for the most ideal treatment instead of medication and pain relievers and such to relieve non-specific neck pain. SMT, we have a lot of familiarity with it. I've been using spinal manipulative therapy for over 35 years here at my clinic in Portsmouth, New Hampshire. So one of the things that we wanted to share with the patients is the fact that when we have trauma, we fall asleep in bad postures, we work too late, sleep in a chair watching TV, play sports and fall skiing and slip on the ice. All of these things cause trauma to the human spine and causes joints to go out of position and to get locked in non-functional states called spinal fixation, or in chiropractic it's commonly referred to as a vertebral subluxation. Not a complete dislocation, less than a complete dislocation, but the joints are locked. There's an easy way to validate this because you can take stress studies, forward bending and backward bending, and you can see the limitation and the aberration of movements of the joints on the vertebra, in which joints will either go into forward or backward slippage, or they won't open up enough, or they'll actually, in many cases, especially in the older folks, they'll actually stay backwards even though the head is going forward. I'll draw a configuration of what we see in the aging population so commonly. This is what the head is supposed to do, the head and neck, when you bend forward. It should achieve about 50 degrees of forward flexion and about 60 degrees of extension. We see that the retention of backward bending or extension is not so uncommon. Most people can keep that for a good period of time. But forward bending or flexion is lost very, very commonly. In fact, is what we see on the x-rays is the joints are actually opened up on the front and the upper neck is still in a backward curve and the lower neck goes into a forward curve in the forward bending posture. And so then essentially what we have nicknamed it is Old Gunner's disease, in which the head goes forward like this here, and the center of the head is in front of the shoulders, and they remain like this for so long that there's a bunch of contracture at the upper neck. And so when the patient or person tries to bend forward, the lower neck will bend forward, but the upper neck will not. It will remain in fixed extension. It will happen on any joint, but it happens most prevalently on the upper part of the neck. So that spinal manipulation is just simply going in there with a spinal adjustment, as chiropractors call it, and unlocking the joint. It will not unlock spontaneously very often at all. You have to introduce a force greater than the resistance or impedance that keeps it in its locked position or fixed position in order to restore mobility to any rigid or restricted region of the spine. So a lot of folks in our society don't particularly care for manipulative therapy or spinal manipulative therapy or spinal adjustments, but essentially it's one of the very few and one of the most effective ways to get those joints unlocked and to get them mobile again. Once that has been achieved, however, there's a strong propensity for the musculature, which has been altered by the restriction in motion, to have accommodated these abnormal postures and configuration. And so exercises have to be done to restore symmetry and bilateral equal function and appropriate uprightness. The exercises should be done, or certainly in our office we recommend it very strongly, and we can again establish the validity by pre and post x-rays or follow-up x-rays, in which you not only have to put it through ranges of motion, you have to encourage it to go ahead and redevelop its ideal curve again. We have a marker with some ink in it. So that curve has got to be made to go forward fully, and ideally you want to have about a minimum of about 40 degrees of curve in the neck and the lower back, and with the center of the head balanced over the center of the neck and the center of the lower back. So in the back view, where your right and left are on the right and left sides, We would not want to see a configuration like this. We would want these exercises to be done not just to get random mobility, but to get mobility that actually causes the spine to come around that arc of motion and to line back up into the central position, and also with special fulcrums put in at the apex of the neck and the low back curve to make those curves come back in and to open up the joints to cause a little bit of decompression and run the spine through ranges of motion. So go ahead and get the vertebra unlocked, the regions unlocked, and then do exercises to retrain the musculature and the ligamentous tissue and to rehydrate and open up those disc spaces to return to ideal form and function. Now that's not new to we chiropractors, but a lot of folks making a big to-do about it in the journals today, and it is far better than all the complications that are caused by medications. If you look in one of our articles on the website in most recently, we'll talk about non-steroidal anti-inflammatory drugs that are most commonly used, the aspirins and the like, to try to get rid of pain. And we have quite a lot of research that validates that that's quite a lot of risk for the human body, and it should not be done on a regular basis, especially in high dosages, and not routinely for muscle pain and joint pain. It is better to exercise it out. That's what I've been advocating for many years, and now the literature clearly says that we were right.